I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course.
We're
Bob.
saying it in our opinion a lot louder today, aren't we? Okay, today, Brad, we're going to talk about back pain for dummies. This is basically a video guide for beginners. If you don't know how to treat your back pain at all, I don't care if you have acute pain, which means recent pain, or chronic. These are some things you can start with.
Sure.
All right, we don't mean that you're dummies.
No,
Right.
absolutely not.
It's
The
just
title is a little...
It's we're the dummies trying to teach us. But anyway, let's start off. We have basically two general rules we try to follow with back pain, no matter, again, if it's acute or chronic. The first thing is you want to try to keep your back moving in some fashion. You want to get it moving.
Find those pain-free ways that don't irritate it, but keep it moving.
Exactly. That's the biggest point, isn't it, Brad?
Right.
Finding things that you can do without irritating them.
Right.
So one of the simplest things is we generally have people start walking. You know, even with people that are kind of come limping in, if they start to feel better after they've been walking a little bit, that's a great thing for them to do.
Right, right. And sometimes it may only be 2 blocks, and then it starts to hurt. Well, walk that 2 blocks, then sit down or do
Right,
rest.
give some relief to it. Ideally, you want to try to walk up to 20 minutes. You start getting more nutrition to the back, more healing,
The
and more blood
circulation.
flow. Yeah. All right, the other thing is we probably start off with more than anything else is press-ups, because most injuries are caused by the back going into this bent forward position.
Picking something
Yeah.
up, slouch
Lifting.
posture.
So we found out, it's been discovered, not by us, is that by going the opposite direction, putting the back in the opposite direction actually starts to provide a healing
Right.
capacity, right? So Brad, do you want to get into that, or do you want me to
Sure.
do a press-up?
We'll do that.
So you're going to start off, and a lot of times you just want to lay on your stomach for a little bit, and then eventually you might even get up on your elbows a little bit, and just let it relax there. Let it sag a little bit. Again, you're sagging the opposite direction of which, again, this is going to be helpful for about 80% of the people that they found. Then finally, if that starts to feel okay, you might want to start a press-up in itself where you put your hands underneath your shoulders, and then you're going to go ahead and keep your bottom down, and you're going to go ahead and press up. Good.
You might just start with small ones.
Yep.
Don't do this.
Right, don't lift up your pelvis. That's the number one thing. You're trying to get a bend back here, kind of get an arch back here. So he's pressing up, pressure on, pressure off. Pressure on, pressure off. And eventually, Brad, you can try to go all the way up, right?
Yeah, as it's feeling better, and this does not create any pain except for centralizing it, which we haven't talked about, but the pain goes more towards the center of your back, then you can go higher.
Okay, why don't you flip over onto your back now, Brad?
Okay.
That's the one we're going to recommend for the vast majority of people. Again, it should make your pain feel better. It might even narrow up your pain somewhat. It should feel like the right thing.
Right.
If that's one you can't do, it doesn't feel right, the next one I might have you try, which we have almost everybody do, if they're not able to do much, is we do have them do what we call trunk rotations here. Now this is getting the hips moving, but it's also moving the back. It's just a real simple one you can do. Wake up in the morning, go ahead and do this before you get out of bed.
And you might find one direction hurts, so you're going to stay away from that, but the other direction feels okay. Then you're just going to work in the pain-free range, maybe just that one direction, and then the other side will eventually come. But you don't want to make things hurt.
Do not irritate things.
Right.
How often do you do these? This one I do maybe 3 times a day.
Right.
The press-ups, if they're helpful, we have people do those almost every hour if they
Right.
want. They can do 10 of those every hour, 10 or 20 of those every hour. Now, for a smaller subset, which you fall into that subset, Brad, flexion might actually be good for them. And so that's one where they're actually going to do knees to chest. You're going to start off with one knee to chest first, Brad, or do you want to try both?
Well, you can start with one knee to chest. This really does depend on the individual, but you can start, and if you do 10 of these and it feels good, that's a good sign. You want to check the other side. If you can do the other side and that feels good, then you may want to go to both knees up.
Yep.
And it's not just with one, but if you do 10, and by the 10th one, things feel better and better and better, you don't have any leg pain, and it feels just better overall, that would be an indication this would be versus laying on your stomach.
Most people, this is not going to make things better. Most people, this is going to make things worse. So you really got to experiment here. Do the press-ups make it better? Do the rotations make it better? Do the flexion make it better? Does the flexion make it? You're not generally going to do all three.
Right.
You're generally going to do one. So why don't you sit up, Brad, now, if you would. All right, that's rule number one. Get your back moving. We're giving you some examples. Rule number two is stop harming your back. Let's stop hurting it. And generally for most people, the way you're harming your back is you're putting it in what we call the C posture. So this is, Brad's head would be here. This is his pelvis. This is the back. Put it in this rounded out posture. And how do most people do this, Brad? Just what you're doing right now.
Sitting. Floor posture. Watching TV, looking
at the computer, looking at their telephone screen, sitting at a soft couch. So
I'm gonna go.
You want to somehow get that back up into the straight position again. So one thing, if you're on a couch, you want to go ahead and put a throw pillow behind. You know, one of these ugly Packer pillows would work.
Oh, Bob.
Just put right back there, and you know that's a double bonus because you're squeezing the hell out of that Packer, and you're getting some support. So.
Bob.
All right.
You need therapy for that.
Yeah,
Bob.
I do. I need a little anger therapy. For your car or for the office, what you might just take a towel and roll it up.
Right.
And put some duct tape around it, right?
Sure. Yep. And then that's going to go right there. And you know this is right because when you put it there, I just worked with someone the other day with this. Put it there and she goes, oh, wow, that feels good when I lean into it. And that's if you go in there and it feels like, ow, and it just feels like a big bump there and it's hurting things, it's either too big or there's something else that needs to be worked with.
Exactly.
But usually this is going to work well.
And if you find that works out well, then eventually you could buy one online. You could buy a lumbar support.
Right.
You know, Brad and I use these in our car. This is just some foam that we had made ourselves.
Right.
And you can put them together for a double roll there, but this works pretty good.
I tell you, I've been on trips in my car where I've grabbed one of those plastic things, a Pepsi that was empty, and I'd put that back.
I've done the same. That's funny that he says that because I've done the exact same thing.
Stick your hand behind your back when you're driving.
Yeah, I'm so accustomed to having something back there now if I don't have it. When you're sleeping at night, sometimes we've even had people put a sheet all the way around them to give some support to it.
Right.
But that's probably beyond the scope of this video. So you want to make sure you're lifting correct. When they say lift with your legs and not your back, what they're saying is don't go like this. You bend your legs and you're keeping your back straight like it's in a cast.
Right.
So.
And you can bend your knees.
And still lift wrong,
Right,
can't you?
go like this.
Yeah.
I'm bending my knees, but my back is still
Rounded out,
It's
so.
got to be like this. Anyway.
Excellent point, Brad. You look like a body, a lifter,
Right,
a weightlifter.
strong like bull.
Strong like bull.
You better believe it.
All right, speaking of which, let's come to that time now to say goodbye, and please subscribe if you haven't already.
Right, because we're going to continue to help you out, except for that broken heart.
That's right. We can fix just about anything, but we can't fix.
Doesn't matter now because
We already screwed it up.
We're so long into this video, no one's watching.
Broken heart. Boom, boom, boom.